dear family and friends, it's Margie with another update. I can't believe it has been not quite 2 months since brain surgery, but getting close to it. It was at the end of February, and we're getting toward the end of April now. So another week about, and it will be 2 months since that time. And it just blows my mind how much has happened in that time. It's been an extremely busy time period, just of appointments and phone calls and treatments. Just a lot to catch you up on, and I'll do my best. I'm not a woman of few words, but still to give you what I can for updates, and feel free to put me on double speed if you would like while we go along here for your own time's sake. But first of all, I wanted to update you on the treatment progress that I've had. Last time, if you remember from my update, I did end up finding out not only about having brain cancer, having that surgically removed and starting to recover from that, but I also discovered, unfortunately, through scans, that I did have other areas of cancer spread throughout my body. And those happen to be the lung, my right lung, and also it's one of my vertebrae in my back, and my sternum, as well as my liver. So there was some spread. Unfortunately, the chemotherapy that I was on over the fall and winter was not effective at all, it seems, in stopping cancer spread. So we did need to address that. I was so very thankful, though. I have a great team of doctors that I'm working with, and they did grant me the ability to do radiation therapy on those areas. So that is a big part of what I've been doing the last few weeks here. Most of April so far, I've been doing radiation treatment. They did what I like to call a spot clean of the brain after surgery. They radiated that for about 3 days. It's amazing how quickly these treatments can be done. That is one thing. Whereas chemo is often a 3-month course, these can be done often in a matter of days. So the brain was radiated to make sure, hopefully, that they got everything. Also, after that, the lung and the bones were radiated, and again, this was a few-week process, and it was all at Abbott Northwestern in Minneapolis, so a lot of commuting back and forth between here and there, but excellent doctors and just people in care there at Abbott. And I just finished radiation on Friday this last week. So that was a huge milestone. And honestly, for any of you who are curious, the difference between the cancer treatments, radiation is a lot gentler compared to chemo on your body, because radiation is usually, now in today's medicine, treating a localized area of the body. So for example, if we're radiating lung cancer, we're targeting specifically just the lung. Whereas if you're doing chemotherapy for, say, lung cancer, you are taking chemo that is going all over your body and affecting all of your body at once. So the effects of radiation are usually less severe. There's still fatigue. I did get tired, but there's no pain, there's no nausea, a lot more easy to tolerate. So that was a blessing, and honestly, once you're there, you just lay down on the bed that they have for you. The room was kind of like a planetarium, where there's actually glow-in-the-dark stars that patients can look at as these beams come out and radiate the cancer. It was kind of fun. Even toward the end of my treatments, the kids got to come one day, and they showed them the room, and we said, this is the place where mommy gets her cancer zapped out. So it was just fun to be able to share that with them. You know, is it the most healthy? Do I wish that I didn't have to do it? Of course. But anything we can do to add what I would like to call silver linings to these experiences are good. So it was really special though on Friday, my last day of radiation. They gave me a diploma, and doctors and workers who had all helped me during the process signed their names, and now I have that for my records, and just to as a way of showing what God helped me through. And then at the front near the lobby for the radiation, they have a bell that you can ring once you've completed your treatments, and I got to ring that bell on Friday, so that was special to me. You know, it's the little things that we need to celebrate in life, the big and little things. I will say, even though the therapy itself of radiation was not as hard on me, the one hard thing during that time was being on steroids. You have to be on a steroid to protect you from the inflammation that's caused from radiation. And I have a whole new appreciation for that phrase, such and such on steroids. Basically, it just means this person is really intense when they're on steroids. And I found that out the hard way, where basically steroids make you feel amped up. I've never taken recreational drugs, but I imagine it's what you feel like when you're on amphetamines, where you are just go, go, go. You feel like everything is urgent, you're irritable, and honestly, I probably apologized to Caleb and the kids multiple times every day that I was on steroids, because it just was rough. It was not who I was used to being on that. I felt like it would make you want to be fast too, and I sometimes would speak like an auctioneer because it was just the speed it made your body and mind move at. And yeah, there was the speed and just moving around fast like an Energizer bunny. Even though I would feel exhausted from radiation, it was really surreal. And the other thing that was unfortunate, which I'm sure you can all see, is it did make me gain quite a bit of weight. That's common with steroids, is the weight gain. But hey, I'm starting physical therapy this week, and I'm hoping they can whip me back in shape. It's been crazy. I've had 3 surgeries in this last year for cancer-related things. First to the colorectal area, then when it metastasized to the lung, and then lastly this brain one. And I do need to recover some strength and get stronger again after that. So I'm looking forward to them whipping me back into shape with that. I think that will be very good. Just to tell you guys about what's next on the horizon, they are not done treating the metastasis or cancer spread yet. Originally, they were going to radiate my liver as well, but because they had trouble seeing the liver lesion on the scan, and this is common, I guess, because it's so near where your lungs are and where you're breathing, they really couldn't get a good visual, and they said the next best thing, if you're not going to radiate the liver, is to do what's called a liver ablation. And that's where they go in, they put you to sleep, thankfully, and then afterward they go in and they basically heat and kill the cancer, and then they take it out. And then through scans, periodically you're monitored to make sure that cancer does not come back and spread. So I have that this Friday coming up at Abbott Northwestern. I sure appreciate any and all prayers for that. Then afterward, I will have treated all the areas of cancer spread that we know about. So that's a great thing. Then the week following that, the end of April, I have a follow-up brain scan. Unfortunately, brain cancer can move quickly, and the highest risk time for it to reoccur is within the first 12 months after you've had a brain tumor or brain surgery. And so they are going to keep a very close eye on that, which I'm super thankful for. One thing that I am reassured about, and I've talked to the radiation doctor about, is it sounds like as long as any cancer in the brain is caught early, we can radiate it away, and we shouldn't need to do surgery again. So that is a blessing. The less invasive is great. It's not that I at all flippantly say, let's just radiate my brain. But when you consider the risks associated with opening up someone's skull and doing surgery, or how damaging long-term chemo can be, you know, I'm so very thankful to have radiation as an option in my back pocket too. Beyond that, in the middle of May, I should be resuming chemo again. Like I said, unfortunately, this fall winter chemo did not work. Will not be returning to that, thankfully. But the summer chemo seemed to have been effective. And so we're going to do what's called a retrial of that to see if it can again be effective. Now, the danger with cancer, because it is kind of its own living thing, is it has the capability of adapting. And what once worked for it may not work again. It may, quote unquote, remember what it had come up against before. And it almost, to my understanding, has its own immune system or ways of adapting sometimes. And that is a concern. So that's why I kind of segue into my next part of updates is what I call my plan Bs, my additional steps to try to safeguard myself in case chemo isn't effective this time around. And one of the things one of my oncologists recommended was that I consult with Mayo Clinic again. I had consulted briefly with them last year, and they basically said stay the course, do standard of care, do what your doctors recommend. But now, since this cancer has advanced, they might recommend different things or new immunotherapies or clinical trials for me. So this could be a very valuable avenue for me. Also, I was really excited. I got into the University of Minnesota to have an appointment with one of their doctors as well, and they will also give me their opinion. So the beginning week of May, May 5th and 6th, I am consulting with Mayo, and then May 8th, I'm consulting with U of M as well. So they will give their opinions and weigh in. And then as long as nothing's changed, I would start chemo the following week. But it's possible I might start chemo with an added immunotherapy or some additional medication or treatment that they recommend based on what they see of my case. And also, to add to that, they recommend, so I had what's called a genomic profile done last year around this time of my cancer tumor that they originally found and took out. And when several months have gone by, again, because of this idea of cancer changing and adapting, and especially if it's shown spread like it has in my case, it's very valid to do another genomic profile of the cancer. And what that basically shows is it's a genetic report that looks at the mutations that are driving your particular cancer. So that can be very valuable for me, because if my mutations have changed at all, especially, and even if they haven't, then we know how best to target them with medicine and treatment. So that test is being redone, reprocessed as I speak, and I will be waiting for the results for that. Abbott Northwestern, that I've been working with a lot, that hospital has what's called a tumor review board, and It's basically a board that looks over complex patient cases and makes recommendations, and they will be doing that as soon as those genetic results come in. So that those three local, what I like to hopefully call superpowers, are on my side coming in May. And I am very hopeful they will have good recommendations for me as well. Another thing that I've done is I've started to work with 2 integrative doctors. And integrative, for those of you not familiar with the lingo, basically just means alternative. In one case, one of them is a naturopathic oncologist, someone who specializes in cancer but does it from a more natural lens. The other one is more of a functional doctor, basically does a lot more operating with blood tests, looking at root causes to why do we have this cancer? What's going on inside your body that's causing it? And I'm thrilled to be able to work with both of them. One is from Oregon that I work with long distance. He and his wife run a phenomenal practice there, and he's made a customized protocol based on research around my genetics and cancer for me. And I'm still working on implementing. It's been hard, honestly, with how busy with other cancer treatments and appointments I've been the last few weeks, but I've been working on adding more and more of his protocol to day-to-day life to help me improve and get stronger and recover during this period of time after brain surgery. And the other one is an interesting story too. He was a doctor that got diagnosed himself with brain cancer, and the kind that he had was considered incurable, but he developed a protocol for himself, and within 4 months of being on his own protocol, he was in total remission. And he has created a program to help other people dealing with whether health issues that are chronic or cancer like himself, to be able to overcome those things too. It's not these things are never guarantees, but they definitely all up your odds. And I just want to take a moment to pause here too and thank everyone who has helped us financially in this country. As many of you know, if something is not covered by insurance, which these natural practitioners are not, it can be very expensive and costly. And we've tried, especially with this time period where Caleb is out of a job, we have tried to be very careful with our finances, but yet at the same time strategic to give me the best probability of surviving this cancer. And without you guys' generosity, I wouldn't be in a position to consider these people. And I just want to thank you guys so much. You guys have made so much difference, and you've helped me to do one more layer to increase my odds. With chemo, it's something I'm thankful for, but it's very toxic, and I can't be on it the rest of my life. And I need to look at off-ramp strategies to help me survive this, even if chemo is out of the picture. As I've already found out, chemo doesn't always work. So this is a very important layer, using these natural physicians as well as the experts in conventional medicine too. So I'm very hopeful. I feel like God has really led us down the paths that we've gone on, and I feel you guys' prayers. Thank you, thank you, thank you so much, everyone who prays for me. I see God's hand in my life every day, and I'm just so grateful. Now is mentioned my 1 year anniversary. No, not wedding anniversary. I will be 10 this year, which I'm so excited about, but it's my 1 year anniversary of having my colon out and having what's called an ileostomy. As I've mentioned in my past video, I have a very rare genetic disorder called NTHL1. And basically the two things that it does is it impairs a certain DNA pathway from being able to repair itself. And so it's a lot more likely to develop multiple cancers over one's life. Lovely. But the other thing that it does is what's called polyposis. And basically what that means is it makes lots and lots of polyps, or it can. And one of the main areas that you see polyposis is in the colon. And just to give you a point of reference, a normal person might have, say, a polyp or 5, something like that, in a normal colonoscopy. I had a colonoscopy before the cancer was removed, and I had hundreds of polyps because of this disorder, because DNA couldn't repair itself, and it either makes tumors or lots of polyps. So in my case, these polyps were destroying my colon, and not only that, but they were putting me at high risk for like 80 to 100% chance of developing colon cancer. I had rectal cancer originally, but my colon was at super high risk. I was basically told, when you get your other cancerous tumor removed, you need to get your colon out. And it was really hard. I didn't want to. I knew life would change radically afterward, but it kind of was a situation where we felt there wasn't a safe alternative to it. And it was interesting too, because not everyone realizes it, but just because you have your colon removed doesn't mean that you have to give up your regular plumbing, so to speak. I'm trying to say this in tasteful ways so that no one watching is grossed out. But basically, I could have kept my original plumbing, but because it was rectal cancer, and the odds, even though it was a modest increase, not a super high increase, the odds of my getting cancer again in that area, if I kept it, would go up. If I decided to keep it, I said, let's remove the area of the cancer, let's remove the colon, and I did not keep my original plumbing. Part of the other reason I didn't is I read up on that, and a lot of people who did just reconnect the small intestine to their original plumbing. They ended up with a lot more complications with infection, which I didn't want. And also, basically, when you're having that type of surgery and you're removing the colon and you know, a lot of the plumbing down there, you basically become incontinent. And people who kept that original plumbing often were tied to toilets where they would have to have bowel movements multiple times a day, but they could not control it. And you know, they'd have to be running and nearby to a toilet all the time. And I didn't want that as my life. And even though an ileostomy, which is where part of the small intestine, which is called the ileum, where the name comes from, comes out of the body and into a bag, is very different from how I used to live. I felt that it was worthwhile to do it this way instead, because there's lower cancer risk of it coming back in the same area. There's lower infection risk. At least if something goes into a bag and the bagging system is working well, you don't have to worry about staying near a toilet or having accidents nearly as much. I wanted that freedom, and I visualized a life where I was cancer-free someday and going on vacation and able to watch my kids. And you know, I wanted to live as normally as possible. So kind of counterintuitively, I thought to myself, you know, the best way to get the life that I want someday, that's as close to normal, is to do something that is abnormal, which is to have my small intestine come out of my stomach and into a bag. And in all honesty, it has not been a picnic. It has been a huge learning curve. Tremendous. One of the hardest things in this journey, honestly, so far that I've done. Having an ileostomy is very unique. There are definitely people who have them, but you end up learning more about how to care for yourself than most medical doctors do. There's some doctors in big cities that are trained on ileostomies, but for the most part, unless you're an ostomy nurse, the ostomy patient knows more about the ileostomy and how to care for themselves than any doctor will. And that was quite the realization once I realized how responsible for myself and my medical care I would need to be. And there's things you need to know about taking care of the skin around the stoma. The stoma is the part of the small intestine that comes out of your stomach. You got to make sure that that stays healthy so you don't get rashes, which rashes promote leaks. And if you get into a cycle of having leaks through your bag, it's hard to stop that. So there are those kind of things. There's also making sure that you eat in a way that is safe for your new digestive system, because there's a lot of foods that can make your bowels at risk of obstructing. For example, raw fruits and vegetables, super healthy foods, but unfortunately with an ileostomy, not safe to eat in that way. Everything has to be well cooked and soft. There has to be no skins. There has to be no seeds. There has to be no just anything that's difficult to digest. Like, can't be tough meat, can't be nuts, can't be seeds unless they're in nut or seed butter. But you kind of have to think about feeding yourself like you're feeding a baby, and you just have this very I don't want to say fragile, but sensitive digestive system. And I had 2 bowel obstructions this last fall, partially because of what I didn't know at the time, partially because of foods that I ate that triggered that response. And bowel obstructions, if that's where your basically small intestine is blocked, they can cause death, because if your small intestine dies, you die. So it's a lot of responsibility and just a lot of things to learn. I know this last summer, I had so many home health nurses coming to teach me how to change my bags and manage things, and it was a rough summer with leaks in the beginning. I am so very thankful I found a great ostomy nurse who finally taught me the secrets to not have leaks anymore, and I am leading a more quote-unquote normal life in that regard. I still bring an ostomy bag with me everywhere to just make sure that if something did go wrong with my bag, that I'm prepared, but I don't think about it a lot, because thankfully leaks are far and few between now, which is such a blessing and was the goal that I had originally when I chose the ileostomy. So it's been a journey. It really has. Life has become so different since I had this surgery. But part of the reason that I'm mentioning this isn't just to inform, but it's to celebrate some of the silver linings along the way, whether that is just the ileostomy journey or the cancer journey or this journey learning about my rare genetic disease. There's just been a ton, and yes, there's been extreme hardships in parts of it, but there's also been things I've been so very thankful for. One of the biggest things with my ileostomy, for example, is before it, I used to get severe migraines for days on at a time if I ate the wrong food. And that was probably because my poor colon was so diseased with all these polyps. As soon as that colon was removed, I did not get migraines either at all, or maybe it would be once a month, and that was it. Huge difference, and I am just so very thankful for that. That's one less thing that I have to worry about in life now. And even though it's hard, Caleb not having a job yet, he is on FMLA right now, where he's able to take care of me, though his job has ended. His contract had to end because his employer was not financially able to continue his contract. But even that situation has been such a blessing in disguise. Only God knew that I would need brain surgery and that I would need extra help at home. And it has been such a blessing having him here for this season. He's still actively looking for jobs, and we hope to find one. His FMLA ends in June, so we're working on that goal. But still, we are so thankful for the timing of everything. Also, I'm just looking at my notes here because I don't want to forget any of the silver linings. But just personal transformation is another one. I'm not the same person that I was when all this started. I would like to think at least that I'm learning to shed the old habits or parts of myself that didn't serve me well and that maybe contributed to where I have found myself. And I feel too, just you live life differently when you see it from a different perspective. And I could still live to be an old woman. I hope I do. But with life being more uncertain, I feel God has given me a clarity and a boldness that I've never had before. And He's been able to use me in ways that I wouldn't have envisioned before. But not only that, but He has used you all too. I have been so humbled and honored by the love that I've seen, and were it not for this extreme situation, I would not have experienced it. I wish that it was never at a cost in any way to any of you. I never want to inconvenience anyone or to ever be a burden. But at the same time, I want to thank you all and say how loved I felt in this whole experience. Maybe the most loved that I've ever felt in my life. And I have experienced so much love through all of you. And I can't thank you enough for that. And I guess I just want to close by saying too, it's been really cool. Even though these last 2 almost months have been very intense, God has given me what I feel like are divine appointments, where I have just run into other believers, and either they've had a word of encouragement for me, or I've had one for them, or sometimes both. And it just really shows me life is not random. There is far more going on behind the scenes than any of us realize. And we might not be able to make sense of this jumbled experience right now, but someday, it says in God's word that though now we see through a mirror dimly, we can't see it all. It's kind of like a camera that's out of focus. Someday we will see things as they truly are, and we will see the import and how much our choices and our actions matter. And I just want to encourage all of you. Some of you might feel like you're stuck in the mundane, you're stuck in a routine. You might not feel like what you do matters, or, oh, that was just a small thing. But it matters to God. Know that what you do has an eternal ripple. And I hope my ripple is as big and as meaningful as it can, whether my life is short or medium or long. But that is my goal, is to be fully at God's disposal and to make the most difference I can. And I hope all of you join me in that. I feel like if you're watching this, then you are doing that because you care about those things. And I just wanted to end too by saying, if any of you have examples of silver linings in your own life, when maybe you've had a hard situation, but God created something good in spite of it, I would love to hear from you. If you want to leave a comment, really, to me, at the heart, it's about community. And I hope that we can build a community here on this channel where we can encourage each other and we can tell our silver linings. We can know that they exist. We can know that, yeah, this is hard right now, but this isn't the end of the story. And we can encourage each other. So if anyone wants to share their own silver linings, please do. And just know how much we appreciate and love each and every one of you. Thank you, if you made it to the end of this long update, so much for all your time and attention. Until next time, God bless you all.